Good Thursday afternoon. I am Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Once again, our moment of gratitude today is dedicated to all of the parents who are finding safe, creative ways for their children to celebrate Halloween. On Tuesday, we spoke about safe and fun ways to hand out candy this year, and today we will focus on some ideas for the trick-or-treaters themselves. This year, if you plan to trick-or-treat in your neighborhood, stick to a small group. Ideally, this would just be your household. But if you decide to include some of your neighbors, please make sure you're keeping at least 6 feet of distance from anyone that does not live in your household with you. Make mask wearing a part of the costume. There are many cute Halloween-themed cloth face masks being sold at various businesses, or you could maybe even make one yourself. But as a reminder, a costume mask is not a substitute for a cloth face mask. Wash your hands before and after trick-or-treating, and definitely make sure you wash them again before you dig into the candy. And it wouldn't be a true public health tip if we didn't remind you to eat a full and healthy dinner before you go trick-or-treating so you don't accidentally fill up on sweets. A sugar rush right before bedtime could make for a very long night. And now we'll move into the local situation. We have 75 new confirmed cases since yesterday's report, giving us 12,903 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 635 probable cases. 12,004 of our cases are considered inactive, giving us 1,431 active cases. 468 individuals have been hospitalized at some point in their illness, and 63 Knox County residents are currently hospitalized. Unfortunately, we have no additional deaths to report today, keeping our total at 103. And now we'll transition into the benchmarks. As a reminder, for the majority of the benchmarks, what we want to see is no 3-day statistically significant shifts with a 2-week time period. All the data we are going to talk about today is on our website, and you can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. Over this time period, we experienced 6 red flags and 1 yellow flag, but they weren't on consecutive days. Over the past 14 days, we have seen an average of 114 new cases a day. Over the past 7 days, that number increases to an average of 129 cases a day. Because of these factors, we are representing this benchmark as yellow. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test resulting turnaround time. For this benchmark, we're utilizing 2 bar graphs, one that shows a sample of tests conducted for Knox County residents and another for average time between specimen collection and lab report data. Regarding testing, there were 5 red flags and 2 yellow flags in this time period, with some of these falling on consecutive days. Since the beginning of October, overall testing seems to be trending in a consistently, but a lower volume than what we would like to see. Regarding lab turnaround time, there were 2 flags on consecutive days. The average turnaround time remains around 2.5 days. And because of all of these factors, we continue to represent this benchmark as yellow. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to initiate investigations for new cases within 24 hours and close contacts within 48 hours. With our current EPI support team, we continue to be able to initiate investigations in the desired time frame, and because of this, our benchmark continues to be green. The fourth benchmark, healthcare system capabilities remain within current or forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID-positive patients and patients with pending test results in hospitals. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS, and they may reflect Knox County, the East Region, or patients from other jurisdictions. During the past 14 days, we have noted 1 red flag and 3 consecutive yellow flags for inpatients with COVID-19. These numbers are the highest we have seen yet and have remained at a consistently high level. Additionally, we noted 4 consecutive red flags for patients in the ICU and 3 consecutive red flags and 2 yellow flags were noted for COVID patients requiring a ventilator. The flags are based on our published metrics that illustrate statistically significant shifts in data. After speaking with our hospital partners, they have recommended that the benchmark remain yellow because they are still within their ability to manage the current number of patients. However, we still want to stress that our community members need to remain vigilant in practicing the 5 core actions and get a flu shot to help ensure our hospitals do not become overburdened. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan their response together to best serve the community. The decisions regarding how to classify this benchmark have been made in concert with our hospital partners, as well as taking all of the data into consideration. Our 5th benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows reported deaths of Knox County residents by date of death. Over the past 2 weeks, we have seen 12 deaths, with 4 in the last 7 days. The information available leads us to represent this benchmark as yellow. And then under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of yesterday, our 14-day trend line shows 24 cases per 100,000, and our 7-day trend line shows 27 cases per 100,000. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 9.9%. Both of these charts will continue to be updated on Wednesdays. And I'll now open it up for questions.
All right, as a reminder, you can submit your questions into the chat feature. All right, the first question we have is from Bob Morgan with Knoxville Liberty Press. We saw the survey results from the Board of Health meeting last night. How does this survey impact the public policy regarding COVID?
Well, I think that the survey that was discussed talked about Tennesseans' attitudes and their beliefs towards the pandemic and to the measures that have been implemented throughout the state. Again, that was a statewide survey. And for how policy will be affected by that, that would be a question for the Board of Health because they're the ones who are making that information. But I think hearing of the widespread support for mandates such as masks and those things is helpful to everybody to hear from the statewide group or the statewide survey.
From Daniel with WBIR, have you noticed any trends or bumps in cases that could be associated with last week's fall break in Knox County?
We really haven't yet. It'd probably be a little bit quick to start being able to see that. We probably, if we were to see any of that, it'd probably be into the next week or so. But at this time, we have not. I wouldn't be surprised if we have some though.
Any further questions, please go ahead and submit them now. From Bob Morgan with Knoxville Liberty Press, how many of your recorded deaths came as a result of COVID only?
So the way that they're reported to us from providers or from the medical examiner's office at the state level or the local medical examiner's office is they're reported to us as a COVID death. I don't have the information on if that was the only diagnosis, but we've talked about this a lot before, that it's a primary diagnosis that's on there. There's different ways to do that, and complications can have a factor as well. But that doesn't mean that the COVID did not make the complications worse that they would have had, and that they wouldn't have died without having the COVID.
Jeff with WATE, are the recent deaths showing any new or different comorbidities?
Not at this point. I believe the last time we talked about this with hospitals, the same trends we were seeing for the most part for hospitalizations. I would have to go that the deaths would come along with that as well. Again, older population and more comorbidities that have been listed before, heart disease and diabetes and things of that nature.
Vincent with the Sentinel, why is it important for the red flag days to be in consecutive days?
That's really a demonstration to us of how steep the growth is, and the more steep that is, the more concerning that is. And so that's really just, it gives us an idea of the trajectory of where our data is going to help make decisions on how we want to move forward and what we want to focus on.
All right, any further questions? Please go ahead and submit them now. Oh, I'm sorry, I overlooked one right there. Bob Morgan with Knox Liberty Press. When will the additional surge beds and ventilators be implemented? Would this be when your benchmark is read?
That would be a question for the hospitals, and so I would suggest that you ask the hospitals that question, Bob. There's a lot of things that can come into play there on when they have to implement their surge beds. In some cases, in some areas, they may have already started doing that. And so there's lots of movement that happens with staff and the acuity of patients. They've talked about that a lot. So definitely direct those questions to them for more specific information.
From Jeff with WATE, do you still believe that there is a greater viral load in the community than the tests show?
You know, we had a really good week of testing last week, and then it's been, or the week before last, and it's been back down as well. So I can tell you what we're seeing is our positive cases are kind of across the board. There's not a trend that's coming out there, and to me, that's an indicator of more community spread. So we're not being able to identify a certain population or group that we were seeing it in, like we were able to see back in August and September. So again, really want to continue to encourage the public to follow those 5 core actions all the time, making sure that when you're, you know, at your home with your friends that are coming over, that you're following them then as well, or family gatherings, all of those things. We need to make sure we're following those all the time to help limit the spread of this disease.
All right, any further questions? Also from Jeff with WATE, we noticed a change in the case count this morning, new cases to 75 today after reporting another number.
Yeah, that was a simple typo in the data that we send from here over to the IT department to publish. It wasn't a mistake in the data itself, just again, a finger typing issue. So, and again, I should say, and I think this is a good point to point out, that the amount of data that we publish daily is just unprecedented. And so there are humans that are doing it, and sometimes these things happen, and we corrected it as soon as we were made aware of it and were able to figure out what the situation was.
All right, any further questions? Please go ahead and submit them. Jeff with WATE, the election office is setting up a COVID positive voting location. Is that a concern?
That as long as, you know, we want people to be able to vote. That's a very important thing for our whole nation. And so we would encourage everyone that's doing that to follow the 5 core actions. And I'm sure that they'll do everything they can to implement infection control prevention measures to make that safe for those people to be able to exercise their right to vote.
All right, any further questions? Please go ahead and submit them now. All right, I'm not seeing any other questions come in. So thank you all for your time, and we will see you again on Tuesday at 12:30 of next week. Have a good rest of your day.